First, let me say, don't freak out. Talking dogs are more common than you think, so just accept it. It's no big deal. Now that that's out of the way, hello, students. Hello, Miss Martin. My name is Benny, and I'm helping out my dad by making this video. He sure has been working hard lately, so I thought I'd give him a break and take care of this assignment for him. Enjoy!
Hey, Benny!
Yeah, Monkey?
What are these?
Those are Daddy's books. He's studying to be a nurse.
Oh, I got in trouble for peeing in Mom's purse.
No, Monkey, not purse. Nurse. They help people when they're sick.
Like telling them to eat grass when they have a tummy ache?
No, people are a little more complicated than dogs.
Boy, I'll say, look at all these big books. Hey, what's pickle cell anemia?
Sickle cell anemia. It's a hereditary blood disorder in which the hemoglobin has an abnormality which causes the red blood cells to take on a sickle-like shape. You see, the red blood cells are normally round and flat and move through your circulatory system with ease, but with sickle cell anemia, the red blood cells take on a long sickle shape.
What happens when the cells change shape?
These sickle-shaped cells clump together, causing vascular obstruction and vascular inflammation. These vascular obstructions lead to ischemia. This ischemia can cause pain or even tissue death.
Yikes!
Yup, and these obstructions can occur anywhere in the body. If they occur in the extremities, you can have swelling and pain in your hands, feet, or joints. If they occur in the kidneys, you could have hematuria.
Isn't that blood in your pee?
Yup, and I don't know about you, but I like to paint the hydrants yellow, not red.
Yeah, what else could happen?
Well, some pretty bad stuff. If major blood vessels in the brain become obstructed, you could have a stroke. There are different kinds of episodes or crises people with sickle cell anemia can have.
Yeah, I'm reading here that there's a vaso-occlusive crisis, sometimes called a painful episode, in which the ischemia results in mild to severe pain that can last minutes or even days.
Yup, and in a sequestration crisis, blood will pool in the spleen or sometimes in the liver, causing a decreased blood volume which can lead to shock.
There's also another one here called anaplastic crisis, in which a viral infection can cause a decrease in red blood cell production, resulting in profound anemia.
Hi, Monkey. Did you know that 90,000 Americans currently have sickle cell anemia? Primarily African Americans.
Wow, so are you born with it?
Babies born with sickle cell anemia usually do not present with symptoms until later in infancy because the newborn's fetal hemoglobin outnumber the abnormal hemoglobin.
It says here that as long as 60 to 80% of the baby's hemoglobin is fetal hemoglobin, there will be no sickling of the cells and therefore no symptoms.
Yeah, but unfortunately, fetal hemoglobin rapidly decreases during the first year of life, increasing their risk of having a sickle cell-related complication. A lot of babies get tested at birth for sickle cell anemia. If the baby is found to have sickle cell anemia, prophylactic antibiotics are given to prevent infection.
Prophylactic? Don't you mean prophylactic antibiotics?
Monkey, prophylactic isn't a word, it's prophylactic.
Meow, that is ridiculous. It is prophylactic, not prophylactic. Le meow, le purr.
Get lost, cat.
Meow is like the blind leading the blind. Le meow, le purr.
Beat it, cat, before I teach you a lesson.
Le meow, I cannot hear a word you are saying. Le meow.
Anyway, if left undiagnosed, symptoms will likely manifest during the toddler and preschool years.
Oh, the time they start to pull your tail.
Don't I know it? A common test used to diagnose sickle cell anemia is the sickle turbidity test, also called a sickle dex. It can test blood from a finger stick and yields accurate results in 3 minutes.
Well, that sounds like a perfect solution.
Problem is, the test only tells you if the child has the sickle cell trait. Children with the sickle cell trait don't necessarily have sickle cell anemia.
Oh.
Hemoglobin electrophoresis is required to distinguish between children with the trait and those with the disease.
So once we know someone has sickle cell anemia, what do we do to fix it?
There is no cure for sickle cell anemia. The aim of the treatment is to prevent sickling of the cells and to treat the medical emergencies of sickle cell crises. First, you want the person to rest. Resting minimizes energy expenditure and improves oxygen utilization.
Resting is one of my favorite things.
Yup. And second, you want to keep the person well hydrated. You may need to offer them fluids to drink, or you may need to give them an IV. Electrolyte replacement is important because the hypoxia caused from a sickle cell crisis can result in metabolic acidosis, which will further promote sickling of the cells.
And that causes more pain, right?
Yes, and analgesics are used to manage the pain. Blood transfusions may be required to...
Do you mean transfusions?
That's what I said, Cat. Now get out of here.
Les miens, I do not have to take this abuse. Les peurs.
As I was saying, blood transfusions may be required to treat severe anemia, and antibiotics are used to treat infections.
And nurses get to help with all this, right?
Yes, one of the main responsibilities of the nurse is to help educate the family of a child with sickle cell anemia.
What does the nurse say to the family?
The main things you want to teach the family are to seek medical attention quickly if the child has a fever of 101.3 or higher, to give penicillin as ordered, how to recognize the signs of sickle cell crisis, and above all, to always treat the child normally.
Yeah, you want to make sure you don't make the kid feel different.
You must emphasize the importance hydration plays in preventing sickling of the cells. Heat can be soothing to painful areas, but cold compresses should be avoided because the cold will cause vasoconstriction and promote sickling of the cells.
Yeah, I've always heard that the cold brings sickles.
Monkey, I'm pretty sure you're talking about icicles. But now that you mention it, I guess cold can bring on icicles and sickle cells.
It says right here that most people with sickle cell anemia live into their 50s. Usually, children are able to participate in normal activities without restrictions.
Individuals with higher levels of fetal hemoglobin tend to have a better prognosis with a milder disease that has decreased frequency of sickle cell crisis. The FDA has approved a medication used to increase fetal hemoglobin levels called hydroxyurea. Patients taking hydroxyurea have a 40% reduction in mortality with a decreased need for transfusions.
I feel like I've learned so much about sickle cell anemia. Let's learn about something else now. Let's sniff out a new topic.
I'm smelling lots of good topics here.
Yeah, there's so many books. How can they ever read all of this?
Beats me, Monkey. Hey, this is the chapter about babies. What do you know about sudden infant death syndrome?
Gosh, I don't know nothing about it, Benny. Why don't you teach me?
Yeah, sure. I don't mind. Let's see, where should we start? Well, the information's around here somewhere. Ah, yes. SIDS is the sudden death of an infant under the age of 1 that remains unexplained after complete postmortem examination. There are numerous theories as to the causes of SIDS, but unfortunately it remains a mystery. One theory suggests that SIDS is caused by an abnormality within the brainstem. People have even theorized that certain childhood immunizations are to blame. However, numerous studies have discredited this theory.
So it could happen to anybody?
Well, there are several factors that are believed to increase the risk of SIDS. Maternal smoking, for one, sleeping in the bed with mom and dad,
Hey, we do that.
sleeping on their bellies between the ages of 0 and 6 months,
Gosh, I don't know what I would do if I couldn't sleep on my belly.
soft bedding such as pillows and quilts is also a risk factor for SIDS.
I love sleeping on soft bedding. It's the best. Wait a minute. I sleep in the bed with mom and dad. I sleep on my belly. And I sleep on soft bedding. Do you know if Mama smokes?
No, Mama doesn't smoke. But Monkey, you're 5. That's like 35 in dog years. And besides, I don't think dogs get SIDS.
Oh, good.
There's also things you can do to help prevent SIDS. Choosing breastfeeding over formula feeding, letting the baby suck on a pacifier, and keeping the child up to date on their immunizations.
Are all babies at risk?
All babies are at risk, but some babies are more at risk than others. Babies with a low birth weight, a low APGAR score, a recent viral infection, boy babies, American Indian and African American babies, and babies that have had 2 or more siblings that were victims of SIDS. It's very important for nurses to teach families the risk factors of SIDS and how to lower those risks. Nurses also need to be prepared to provide psychological intervention to parents who are forced to cope with the loss of a child. Not only are the parents in mourning, they also have this added element of being unable to explain exactly how or why this happened. The most important task for the nurse in this very unfortunate situation is to provide an opportunity for the parents to say goodbye to their baby. These are the parents' last moments with their child, and they should be as quiet, meaningful, peaceful, and undisturbed as possible. Parents should be encouraged to hold their babies. Because the parents leave the hospital without their infant, it is helpful to accompany them to the car or arrange for someone else to take them home. Arrangements should be made for a home visit as soon as possible. A common reaction to SIDS is for one parent to blame themselves or the other parent. It is important that the nurse assist parents in working through these feelings to prevent marital disruption in addition to the loss of the child. Well, that's it for SIDS. Hey, Monkey, where'd you go?
I didn't know nursing was so sad.
Oh, Monkey, some of it is sad, but some of it's really happy, and you get to help people through all of it.
You're right, Benny. I'm glad Dad's gonna be a nurse.
Now, what do you say we get out of here and get some dinner?
Oh boy. Bon appetit!